Imagine for a moment, you are at work. You hear gunfire and the unmistakable sounds of people frantically reacting in terror. Ask yourself, what do I do? In 2012, there were over 80 incidents involving armed violent intruders in the United States. This translates to an incident occurring every 4 days. Assuming that you would call 911, what are you going to do in the 2 to 25 minutes it takes for law enforcement to arrive? It is important to understand that law enforcement is not coming to help you directly. Their first priority is to stop the threat. With that in mind, what personal tools or training have you been given to keep you alive during those critical minutes? Mitigation Dynamics Incorporated, or MDI, defines an armed violent intruder as a person on hospital property with the means, opportunity, and apparent intent to inflict serious physical injury or death to others. MDI classifies these incidents as low propensity, high consequence. Once an armed violent intruder fires the first shot, the stopwatch of death begins, and the consequences shock the conscience. The armed violent intruder at Virginia Tech University murdered 32 people and wounded 25 others within just 7 minutes. The armed violent intruder at the movie theater in Aurora, Colorado murdered 12 people and wounded 58 others within 5 minutes. The armed violent intruder at Sandy Hook Elementary School murdered 26 people and wounded 2 others within just minutes. Collectively, these incidents equate to a murder attempt every 6 to 10 seconds. It is not likely that incidents involving armed violent intruders will stop in the near future. However, through the implementation of an effective policy, comprehensive training, and the utilization of scenario-based drills, a hospital and its staff can minimize the overall effects of such incidents. MDI has presented their life-saving Armed Violent Intruder Response training curriculum to thousands of healthcare professionals across the United States. As a result of the overwhelming positive response to the dynamic lecture and breakout sessions, MDI has created an online training series. The Armed Violent Intruder Response online training segment has been specifically customized for the healthcare professional and exceeds regulations set forth by CMS, Joint Commission, and OSHA. It contains the core elements of MDI's principally based doctrine that was created to empower the healthcare professional through a series of reactive, principally based action steps. Designed to be utilized as a quick response guide, it assists with proper decision making during the threat of an armed violent intruder. Dynamic, life-saving, proactive action steps, such as MDI's OUT principles, are discussed and demonstrated in detail. The various principles and strategies relating to the restricting access and limiting the mobility of an armed violent intruder are illustrated. This online training segment also reveals various techniques that will enhance the healthcare professional's existing skill set and further empower them to identify and recognize various danger cues in order to properly react. Team MDI continues to employ their extensive real-world problem-solving experience to create cutting-edge training doctrine customized for the healthcare industry. Our collective goal is to assist your organization in providing a safe environment for all patients, visitors, physicians, and staff so that your organization may continue to prosper in its endeavor to save lives.